beginning this Thursday, January 20th, we're opening up booking opportunities for immunocompromised adult Albertans to receive a 4th dose of COVID-19 vaccine at least 5 months after their 3rd. 4th doses will help those who are immunocompromised to have the same level of immunity as those of us who are receiving our 3rd dose and who are not immunocompromised. This will not only help prevent some breakthrough infections that we've been seeing, but also decrease the chance that people with immune-compromising conditions could have severe outcomes from COVID-19. The list of conditions eligible for a 4th dose remain the same as those who are eligible for a 3rd dose due to a clinical diagnosis or treatment in September of 2021. You can visit alberta.ca to review that list. To be clear, 4th doses are only recommended at this time for those who have these specific medical conditions and are immunocompromised. Others who do not have these clinical conditions are not eligible for 4th doses, even if they're nearing 5 months from a 3rd dose they may have received for travel purposes. Individuals with immunocompromising conditions may still have some risk even with this 4th dose. We must continue to work together to ensure those most vulnerable in our communities are protected. The current variant is highly infectious, and some may even be wondering if it's inevitable if they will get it. I would like to remind people of the reason that Omicron appears to be milder, which is largely because of vaccines. Vaccines dramatically reduce the risk of severe outcomes, even as we have seen some waning of protection against infection. Even with vaccines, getting sick with COVID is not a common cold. You cannot predict how far your infection will spread through others through an ongoing chain of transmission or who it will reach. Unfortunately, at some point, it will likely reach someone for whom COVID-19 is not a mild illness. So for those people, I am asking all Albertans to remain vigilant. We are all connected to each other, those we know and those we don't know, and the actions we take every day make a difference. Turning to today's numbers. Over the last 24 hours, we have identified about 3,279 new cases of COVID-19 and completed about 8,995 tests. Our positivity rate for lab-confirmed cases is 38.8%. There are currently 1,089 people with COVID-19 in hospital, including 104 in the ICU. Sadly, I must announce that 9 new deaths have been reported to Alberta Health over the last 24 hours. My sympathies go out to the family and friends who have lost someone, no matter the cause. As we continue to see, Omicron is highly transmissible, and the province is seeing a rapidly increasing number of cases. We are beginning to see our hospitalizations follow suit. On Sunday, our hospitalizations surpassed 1,000 total for the first time since October 14th. Even if we take into account the proportion of these that are admissions for other causes with an incidental COVID infection, the overall burden on the system is large and growing. This rise will continue to put pressure on our health system and the healthcare workers who take care of us. This affects all of us. Even if we do not personally become ill with COVID-19, we each continue to have regular non-COVID medical needs, and any one of us could need urgent care when we least expect it.